Our next topic will be on respiratory assessment. There are three normal breath sounds. We have vesicular, bronchial, and bronchovesicular. Let's go over them one by one. Vesicular breath sounds are soft blowing sounds, and they are normally heard throughout most of the lung fields. Bronchial breath sounds are louder, high-pitched, and hollow sounding, and they are normally heard over the trachea and the larynx. The bronchovesicular sounds are softer than the bronchial breath sounds and are normally heard on the posterior chest between the scapulae and in the center part of the anterior chest. So remember that in the NCLEX, when you hear these three sounds, they are considered to be normal breath sounds. Now let us discuss abnormal or adventitious breath sounds. So we have four main types. We have wheezing, crackles or ralls, stridor, and pleural friction rub. Now, wheezing is caused by narrowed airways due to bronchospasm or obstruction by secretions. So we have here two types of wheezing. We have the Sibilant Rhonchi or the sonorous rhonchi. Now, Sibilant Rhonchi is a high-pitched whistling sound caused by the passage of air in narrowed airways due to bronchospasm, such as the one found in asthma. Sonorous rhonchi is a lower-pitched sound with a snoring quality due to secretions in large airways. So I would like you to take note the difference between Sibilant Rhonchi and sonorous rhonchi. Now, crackles or ralls are caused by fluid in the airways, especially when the patient has pulmonary edema in heart failure. And there are two types of crackles. We have the fine crackles and the coarse crackles. Fine crackles are soft, high-pitched sounds like rolling hair strands between the fingers in front of the ear. Coarse crackles are louder, low-pitched, and last longer like opening a Velcro. Next, we have stridor. Stridor is caused by airway obstruction such as croup, which is a common respiratory condition in children caused by laryngospasm. It is a high-pitched, harsh sound heard during inspiration, and it is usually an emergency due to respiratory distress. So take note of that in the NCLEX. A pleural friction rub is a sound caused by the inflammation of pleural membranes. Example will be those conditions such as pneumonia or pleuritis. Now, it is the rubbing sound of pleural surfaces that causes pain. So when the patient has a lung infection or pneumonia, the pleural surfaces become inflamed, the visceral and the parietal. So when the lungs expand, the pleural surfaces that are inflamed rub against each other, and that causes pain, and also the sound called pleural friction rub. Okay, so this ends our lecture presentation, and thank you very much, everyone.